Hi everyone. I'm just going to be doing my suture video today. Pardon me not having my lab coat, but it's in the wash getting ready for the next bout of clinicals. So we'll just pretend that I have that on today. I am going to go ahead and suture with an interrupted and a mattress suture on this wound. This wound looks a little bit deep and a little bit wide, so we'll put in a couple mattress sutures to keep that held closed pretty tightly and avoid any high tension. Then I will go ahead and finish the wound off by approximating all the edges with some interrupted sutures. First, what I would do would be that I would open a sterile field, which I don't have today, but I would open a sterile field with irrigation and 2 preps and a couple pairs of sterile gloves, my needle drivers, my forceps, and my sterile scissors. Just for video purposes, everything is not sterile. So what I would do is I would start by donning sterile gloves, and I would irrigate the wound of any contents, any debris or glass shards or gravel or anything, depending on how the injury was sustained. But I would make sure to get all of those particles out of the wound bed and off of the wound. And then I would go ahead and pat as much of the irrigant and any blood out of the wound area. After that, I would go ahead and take off my gloves that I had, and I would don new sterile gloves. After I do that, I am going to go ahead and prep the wound bed with betadine, prep swabs, and get all of that, or the wound edges, all of that cleansed. Just for today's educational purposes, I'm going to use this Vicryl because it's purple and hopefully we can see it a little bit better. But now I actually personally sometimes like to see like a Proline, you know, if they're going to be coming back to have their sutures taken out, because it's a little bit easier to suture with, but versus silk. But you know, we'll go ahead with this one. So I'll go ahead and load my suture onto my driver, and hopefully it's a little bit easier to see. And then I will have my forceps and my scissors. So with this wound, it's approximately about 4 inches in length. So I'm going to try and do just 2, maybe 3 mattress sutures just to kind of keep the tension off of that wound. So I'll go ahead and I will start a little bit wider and deeper. And I do have enough needle, so I will come through the other side at approximately the same width. And we'll pull that so we have about that much on the end. And we will pull and put that so we are backwards on our driver. Maybe. Sorry. So we can go at it from the other angle. And so what we'll do is we're going to go and come a little bit more subcuticular right in that first dermal layer, subcular, and we're going to go into the opposite side and out approximately at the same width and depth. And then we'll pull that tight. So we'll do 2 wraps and pull that mattress tight. And 1, oh, and 2. Got it a little long there, so it's a little bit more cumbersome. 3 and 4. And you can see there how that is, oops, maybe mattressed there a little bit deeper and superficially so that the wound is held together a little bit better. Just given a little bit more of a larger depth. So I'll make sure that my knots are tied and they are tight, and then I will go ahead and maybe got them rather short. All right, so I will do another mattress on the other side of the wound. We will go ahead and pull our, and I tried to do, I'm gonna go at the same depth as the mattress. Oops, and I'm a little far. So I would have anesthetized my wound as well prior to doing this for pain control, obviously. I forgot to mention that with a 1% lidocaine. So we'll go ahead and pull that. Perfect. And then we will load our needle driver in reverse for the mattress. And we will try to go completely perpendicular to what we have there for our suture, but in through that subcuticular layer and up and in at approximately the same depth and the same width across. All right, and so then we will once again do our knot, the 2 wrap, and we will tie that tight, pulling the mattress together nice and taut, not too tight. 2 and 3. My little bugger. And that makes 4. We'll go ahead and suture our tie at the end. All right. You can see that we have our 2 mattress sutures. Hopefully you can see that. All right, so now, sorry about that. For educational purposes or video purposes, to try to make this a little bit short and sweet, I'm going to go ahead and just do 1 or 2 interrupted sutures, but I'm going to do that in another video.